Hi, my name is Dr. Caxton Perry. I graduated from the University of Ibadan in 1989, College of Medicine, and I did my internship in Sokoto University General Hospital. I worked at Adeoyo Hospital. I worked in a few hospitals in Nigeria, and then came to the U.S., worked in the biotech industry, and worked following my residency. I moved to Louisiana. I did my residency in Brooklyn, New York, Brooklyn Hospital Center. And since then, we did a lot of HIV/AIDS, and I actually started running an HIV/AIDS clinic that was federally funded at some point while I was there in Baton Rouge. I owned my own clinic up until 2009 when I felt that the burden of the healthcare system in the direction it's going, it's best for me just to do other things and not have to worry about insurance companies paying me. So for the last 20 years, pretty much, what I've done is a combination of emergency medicine, hospital medicine, and critical care. I run an ICU unit in Rapids Regional Medical Center for nights. I only work nights when I'm in the hospital. In the ER, it doesn't matter. And I did that for a good number of years. I still work ER, I still do critical care, I still do hospital medicine now. So if someone gets put on life support, it's me. If someone sometimes occasionally has to break the news that someone has died in the middle of the night, it's me. And I also treat COVID patients. And the truth of it is, it's here. We've got to know what to do. And when you have the confidence and you have the knowledge, you combine that with an atmosphere that's favorable to you being able to practice. So what we have now is an atmosphere that's hostile to doctors who know what to do with respect to COVID at its early stages, which is, should or should we not use hydroxychloroquine? And I think it's wrong. But not only that, my fight is that the truth about COVID-19, not that it's not as dangerous or as deadly, no, but the truth about how we can take care of it, even if it's here to stay. Are there any treatment strategies that can help? Or should we just discount everything until a vaccine comes? Those are the questions that I try to challenge the system to look at, because doctors are getting results with hydroxychloroquine, but hydroxychloroquine has been touted as ineffective, and the studies that are doing that, when you sit down and read them, all of them basically are semi or absolute frauds in terms of methodology and conclusion.
So I heard you talked about medical divorce and stuff, so you have a background in medical divorce. Can you explain it?
In 1993, there was a couple at Princeton who were doing some research studies, and they were looking at deaths around the world, and looked at 16 different countries around the world, and they found out that, I call it the dead people don't lie phenomenon. If you look at virtually every country in the world where divorces are recorded, there are twice more divorced dead people than married dead people. And it's that simple. And since that time, I began to look at studies and researched in depth and written 2 books on the subject and presented in so many different parts of the world. Exactly why is it that a divorce doubles your risk of a stroke or a heart attack and so many other complications? And that's where I devised divorce medicine and I wrote that first book on how divorce kills and the medical complications of divorce. And divorce is actually a bigger risk factor for a stroke and a heart attack and cancer, as well as suicide, than any other independent factors. And most people are not aware of it.